Everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today, I want to talk about AI technology with scribes in healthcare. If you have watched some of my older videos, maybe you haven't, but I am a proponent for using scribes in the healthcare setting. A lot of this reason is due to my own experience as a manager administrator in the practices and patient complaints about not feeling like they're being listened to very well by the providers. Also, I have experienced the conversations many times with multiple different providers about the administrative burden and how they are getting burnt out because of it. And with the growing trends of people focusing on developing technology in healthcare, something that is coming from it is artificial intelligence scribe. The old school way, if you will, of utilizing scribes and how I use them in the clinic was hiring an individual. Usually we hired somebody who had a desire to work and better their education, further their education in healthcare. So they probably were working on their undergrad, already had their undergrad degree, and they aspired to do more. They wanted to become some kind of provider, whether it was a mid-level or a doctor. They maybe wanted to become a physical therapist, something that required additional schooling. But first, because of the requirements to get into those professional schools, they needed to have on-the-job training. And being a scribe was an excellent way of them obtaining that because they would sit in with the providers, they would listen to how the providers took histories, how they interacted with patients, they would learn about differential diagnoses, they would learn about treatment plans and how it relates to the differential diagnoses, different tests that would be ordered, what would require referrals or prior authorizations. Even our scribes did a lot of coding, and you could use a scribe in any kind of way that you wanted to that fits your workflow and your model in your clinic. In our situation, the scribes did most of the work in the progress notes, and then the providers would just review what was documented, edit anything that they felt was necessary, and make sure that the coding was correct for the visit, and then it would move on to the next step of them completing locking it, signing off on it, and then it would go to our scrubbers and our billing team. So because of that, we would have the scribes meet in a monthly meeting with the billing team and myself as their manager and my associate who was my counterpart on the clinical side. And we would talk about trends we're identifying with coding issues, trends with denials that were coming in, any kind of diagnosis type situations. And we would help educate them further so that we would be more likely to send out clean claims and the billing team wasn't having to fix so much before the claims were submitted. So it really benefited us. And we got a lot of praise from patients because they felt like they were being paid attention to better, right? Because the providers weren't distracted in their eyes trying to type as they talked and not giving them that eye contact that lets people know that they are being heard. And because 80% of our communication is nonverbal, the cues that providers give while they're documenting in an EMR, it lets patients feel uncomfortable and think that they're either not being understood, they're not hearing everything, whatever, however you want to take it. And to be honest with you, I think they held a lot of clout in that because not a lot of us are very good multitaskers. We think we are, and then when it comes to application or identifying areas of gap or ways that we made someone feel like we weren't able to multitask or we have proof we couldn't multitask, it's pretty high. And the fact that we were asking providers to try to multitask by documenting stuff in their chart notes while they're trying to listen to patients is a big deal. And we all know that a lot of times patients will say things in their expressions, their body language, that from the clinical side, from a provider side, if you're good at reading people, which hopefully you are, it helps you ask a little bit more questions when you see certain things or you hear something specific. But if you're distracted on trying to listen and document, you might miss out on those things. So anyway, I was a big proponent of scribes for a large reason. And also, this is due to the growing trend we were seeing with the administrative burden put on providers. We all know the burnout is really high for providers right now, especially in primary care, and the number one reason is the administrative burden. So, all of these software companies are using AI to its benefit and trying to develop software that will enhance the patient experience, reduce provider burnout, and also improve patient care, hopefully, by using some trained software to document visits for providers without having to hire additional people. That means that it would be some kind of device that would be put in the exam room with the provider and the patient that records the information discussed. And it doesn't just transcribe it, because we all have transcription services like Dragon or whatnot, but it actually puts the information that's discussed in the different parts of the progress note where it's appropriate. So even if you're not speaking in the process or in the exact way of the note, like history of present illness, chief complaint, history of present illness, health history. If you're not speaking in that exact order, it's okay, because the software that's being developed for scribing is going to identify speech. It's going to do some native language type training, and this is like technology speak, so you'd want to look it up, and I'm not very good at it either. But it's basically trained to identify your voice and to identify certain language that triggers it and tells it where to put the information in the chart note. And that's fantastic, because we all know patients will go here and go there and go there and there, and sometimes tracking is really difficult. But this software, the more you use it, the more you train it, and based off how it's built initially, it will put it all in for you. And there's some studies out there, there's some people that are already using this, providers' offices, that love it. They are feeling the reduced administrative burden, that stress that they just dread all the time. They are seeing the ability to see more patients in a day because they're not spending so much time documenting stuff. It assists with giving orders to their staff and what needs to be done, what needs to be ordered, what needs prior auths, what needs referrals. And instead of them having to edit a ton of stuff, they're still having to have that due diligence. They're still having to look at it, but it's so infrequent they're having to make changes. And of course, depending on the provider, some might be more picky than others, and depending on maybe why a patient's being seen as well. But providers are able to review the information that's already loaded into that progress note and approve it and move on. It's just the beauty of this. And I haven't seen it used in an office setting besides test settings from watching online and YouTube and reading people's experiences that are using it. But it sounds like it's very promising. And not only does it reduce the administrative burden for providers, improve patient care, but the quality of care, because it's capturing stuff that maybe somebody would forget if they're trying to document after the appointment, right? And if they see 3 or 4 patients before they start documenting, they might forget something, where this is all recorded in real time. And that's great too, because maybe we'll see quality measures increase for patients or providers. And I mean, what better way to, help your patients and yourself all in one than by using this? Because so many people are jumping on this bandwagon and trying to develop the software to sell to healthcare professionals, there is a lot of competition out there. And I don't have an idea of how much it costs. If you're using an electronic medical record system now, you might want to inquire to see if they have that capability, or if they're working on a future capability of this to adopt into your software. I'm sure it will have an extra cost, but you can always do the cost comparison of how much of of your time it takes to complete what the scribe technology would complete for you. Because even though, especially self-owned businesses, self-employed people don't give themselves enough credit, your time is worth money. And so if it is taking 2-3 hours of administrative burden off of you and you're able to have a better work-life balance, if you are less stressed, if your patients are more satisfied, if you can see a few more patients in a day to offset the cost of it, those are all things that should be considered when you want to compare the cost of using that technology and not using that technology. It doesn't always just come down to the cost as in figures of money, but also your sanity, your mental health, your patient satisfaction. I mean, all of that needs to be considered. And also, if you were to hire a scribe, how much would you be paying them, hourly to do that for you? That's another thing, because usually when you hire a staff member, you don't only pay their salary, their wage, but you also usually have to pay benefits, which adds to that. And you wouldn't have to do that for technology. So these are just some things to be aware of, to ask about. Keep your eyes and ears open to kind of maybe see what's going on out there. Look it up on other channels, ask colleagues about it, and just keep it in the back of your mind if it's not something that you're really thrilled about or want to do, or maybe you don't want to put the money out right now. But just keep it out there. Like I said, ask your EMR company about it. Maybe they have other vendors that interface with it. Who knows? But if it's something that you're interested in, if you're feeling really burnt out, you're frustrated with the administrative burden, your patients aren't happy with feeling like you're not paying attention to them when you're treating them, or you're a manager and you're having patients complain about that, this is definitely something to consider and could be a game changer for you. If you have any questions or comments about this, please leave that in the comments below, especially if you have used AI technology for Scribe already. I want to hear about your experience, so please leave that in the comments. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues that might be interested in this topic as well. Thank you as always for the support, and we'll see you next time. Bye-bye.